First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
Hi, I'm Dr. Kenny Levine. Welcome to Health Talk. Health Talk is seen on UVerse Channel 19 and WEYW19.com on the web streaming live. You know, Health Talk is a medical show talking about diseases and wellness from the top of the head to the bottom of the feet. I happen to be a periodontist. I'm a dentist. I treat gum and bone disease in patients of all ages, from ages of 3 to 4 days old up to their great-grandparents, almost 100 days old. We treat early infants, young infants who can't nurse properly, and those patients are treated with the lasers so they can have proper nourishment and mothers can take care of them with no pain. You know, as a periodontist, over the years, our emphasis has changed. In the past, we treated infections of the gum and bone, but today we're dealing with cosmetic procedures. We're dealing with patients who have difficulty chewing properly, who are missing one, some, or all of their teeth. Patients in the past were very anxious to go to the dentist. They thought they were going to go to their grandparents' dentist or their parents' dentist. So today's expectations are much different. We can treat patients in comfort and complete ease so that they are able to function properly. With sedation, they're able to go through their procedure, many times thinking that they've been here for only 10 minutes. So dentistry today is different. The future of dentistry is different, and the future is right now. Talking about the changing future of dentistry, I'm here with Dr. Brad Ginzler. Brad, welcome.
How are you?
Brad is an endodontist, and as an endodontist, you're a dental specialist. You know very well that for 36 or 37 years I practiced with an endodontist who retired, and since he retired, I have an opportunity to work with other endodontists. Tell us a little bit about your background, why you decided to be a dentist and an endodontist specifically.
So I'm from Detroit originally. Grew up the son of a orthodontist, and when I went to dental school, I originally had thoughts of practicing as an orthodontist. However, quickly in my dental training, I realized that I didn't love orthodontics, and found soon that I preferred to treat problems of the roots of the teeth and dental pain more specifically.
You know, it's interesting because I grew up the son of a general dentist. It didn't take me long to learn that I didn't want to be a general dentist. I didn't want to have to make dentures and deal with those issues. So you were, at what year in school did you decide that you weren't going to be an orthodontist?
Of course, we didn't really get our training until about the third year, so I'm 3 years into school and figured now I need to figure out something else to do. Fortunately, with the general dentistry training that I had, I was interested enough to continue, and I ended up at UCLA, did a residency at the hospital there. And
general dentistry?
General dentistry residency. And I practiced as a general dentist for a couple of years after in Los Angeles. In doing that, I hooked up with a general dentist who had an endodontist come into his office and would treat patients there, and through mirroring him and watching his work really is what spurred my interest in endodontics. And endodontics has really come a long way since even when I trained as a general dentist.
Now you went to dental school where?
University of Detroit.
And then you were a couple of years out, and when did you do your endo training?
Went back to Detroit and did my endodontic training. And it was there that I was introduced to a group out of San Diego called TDO. It's a group of clinicians that practice very contemporary endodontics, microscope-based, evidence-based, and we're really trying to do a lot to preserve teeth in a different way. You know, old endodontic access was typically straight line access, and I'm sure you're familiar with straight line access, and you're really opening up the tooth a lot more significantly than probably needs to. So
taking away a lot of tooth structure to be able to sit.
Right. So you're cutting, and once we cut, we can't uncut a tooth. So today we're trying to use the microscope to limit the amount of tooth structure that we're removing, which is going to ultimately keep more of your own natural tooth in place, which allows the tooth better chance at preservation long term, which really that's one of my main goals.
You know, as a restorative dentists, which I'm not, the restorative dentists today are dealing with the preservation of tooth structure with veneers and bonding as compared to cutting all the teeth down.
Absolutely.
For crowns. We're going to come back in a moment. We're going to continue this discussion with you about preserving tooth structure. I'm Dr. Kenny Levine with Health Talk. We'll be back in a moment. Thank you.